everyone, and welcome to The Doctor Is In. I'm Dr. Freddie Gomez, and we're ready to provide you with the virtual care that you need in this time of COVID 19. So, as the country eases quarantine restrictions and more testing is happening, we're also seeing a surge in COVID 19 cases. So, because of this, even last Sunday, highest recorded cases, because of all of this, we must be more vigilant, a lot more careful when we go out and about during our day. Today will help you understand how you can and should do, and what you should do to stay safe when you're out and about. So, to help you do that, we are joined today by a family physician, Dr. Aileen Espina. She's also a fellow at the Philippine Academy of Family Physicians. Welcome to the show, Dr. Aileen. Okay, we're trying to get Dr. Aileen on the phone, but just to reiterate, this episode is definitely for you. So ginagawa namin itong show na to para sa inyo. And ang focus namin sa episode na ito is in order for you to know what to do when you are going out of your house, ano? Because as you all know, the safest way is still to remain at home. To stay home is the best chance na we have not contracting the virus. But in case, alam natin lahat na everyone has to do their own chores, they have to go to work. This episode is for you in order to tell you what to do. Okay, we have Dr. Aileen back on the line. Dr. Aileen, can you hear me?
Yes, thank you, Doc Ferdino. And thank you very much for inviting me here this afternoon. It gives me great pleasure to be with you here to share with you some inputs and
Okay.
recommendations about how to thrive in the new normal, sabi nga natin. So
Right,
how to go
that's right.
about
So we want to
our
help
daily
everyone to
lives.
safely navigate this new normal. Sa paglalabas-labas natin, especially when we go out to work, when we run errands, or kahit anumang kailangan gawin, ano? How do we stay safe?
Yes. We have already been provided ng marami ng guidelines ang ibinigay sa atin ng Department of Health regarding our conduct in public spaces whenever we go out, no. There is even an infographic that is already available which you can download from the DOH website. What is very basic here is that kailangan po nakamask tayo pag lumalabas. Bakit po? Kasi po, it is a way by which we can protect ourselves from infecting others and from getting infected ourselves. Ang pagsusuot po ng mask ay isa pong pagpapahalaga at pagrespeto sa ating katawan at sa ating kapwa. Okay? So that is the first thing that should be na nasa utak po natin. Kung kinakailangan po nating lumabas, as what Dr. Ferdy has said, the best pa rin is to stay at home. Pero kung talagang kailangan ho nating lumabas, please wear a mask. Hindi po kailangan ng N95 or ng surgical mask, an ordinary cloth mask. For us, ordinary people doing ordinary chores in an ordinary day, a cloth mask which you can reuse, kailangan lang pong labhan pagkatapos gamitin, is enough. It will suffice. It is only medical professionals.
Sorry to
Yes?
Yes, Doctor, sorry to interrupt you, but let's tell our viewers kung ano yung mga lugar ang pinaka-common para pwede maiwasan kung sakali. What are the common places that are at high risk of exposure to the virus?
Okay. So, meron po tayong tinatawag na 3 C, no? 3 Cs. So, these are crowded places, yung maraming mataong lugar, okay? Mataong lugar. So, halimbawa palengke, simbahan, yung bus station or taxi station, so yung marami pong tao. As much as possible po, we are to avoid mingling, yung kasama po tayo sa maraming tao. So crowded spaces. Second, yung sarado po, enclosed spaces, lalo na po yung mga naka-aircon, yung kulob, yung kulong or kulob, no? And then, yung lugar po where there can be close contact with other people. Pwede po siyang hindi matao, pero tayo po ay malapit sa isa't isa, no? Halimbawa po, tayo po ay kakain sa restaurant or tayo po ay makikipag-inuman sa ating mga kaibigan, yung ganun pong klaseng activities that will promote close contact with other people, it can also facilitate po the risk of exposure. So yun po yung tatlong C na dapat nating iwasan. Crowded, enclosed, and places where close contact is facilitated. Okay? So yun po, Doc Ferdy.
That's right. Yes. Yes, that's definitely right. So kailangan ingatan talaga dahil if one member of the family catches the virus, that person can infect the other members of the household. So lalo na kung galing ka sa mga crowded places like you mentioned or enclosed places. So here we'll have a video simulation to show just how easy it is to be able to catch this virus in such places. And in this video, you will be able to see a simulation of how viruses are spread. So here, as you can see, the neon green cloud represents aerosol particles coming from a person who has coughed or sneezed. So you can just look at the virus or the bacteria can really spread from one aisle to another very easily once it gets into the air, once it gets aerosolized, kung tawagin nila, no? So, paano ba talaga nahahawa? Paano ba talaga nahahawa or napapasa itong virus? So, let's review that, Dr. Aileen. And of course, the safeguards we need to put in place.
Yeah. So tama po 'yun, no? Thank you for this informative video, Doc Ferdy. So, ang virus inside a person harboring the infection, kahit wala pa po siyang symptom, because it is already been proven that 2 days before the onset of symptoms, bago pa po siya nagkakaroon ng lagnat, ng sipon, or ng ubo, yung infected person can already transmit the virus through ordinary activities like talking, sneezing, coughing, and even singing. So yung po, no, when you expel out, when you talk, the virus is it stays in the respiratory droplets, yung tilamsik po ng laway. No, it stays there. And then if you are in front of the person, because it is said that it can be carried to as much as 6 feet away, no, as much as 2 meters away. So if you are within that distance, malalanghap po ninyo yung virus, and the virus will enter through your nose, through your mouth, or through your eyes. So through the mucosa of the eye, through the nose, and through the mouth. That is why it's very important that all of us are wearing masks, because if you wear a mask, then you decrease the chances na yung laway mo ay titilamsik, or yung when you sneeze, nagtitilamsik siya. And then on the other end, if the person is also wearing a mask, hindi rin niya po ito malalanghap or mai-ingest, no? And then another thing is, the virus in the air will land on surfaces. So, pwede po siyang mag-land on surfaces. Like, for example, in the escalator or in the doorknobs, no, yung mga handrails. So, ito po, the virus can stay there. And when I touch it, the virus will now stick into my hands. And then, when I unconsciously touch my nose, para ko pong hinatid yung virus into my body. That is why it's very important for us to wash our hands. Okay? Wash your hands properly for 20 seconds with soap and water, ordinary soap and water, so that matatanggal po yung virus. Kung wala po tayong available na soap and water, a hand rub using alcohol-based hand sanitizers will suffice. So whenever we go out right now po, aside from wearing a mask, we should always bring with us a sachet of probably liquid soap or soap, no? And then, or hand sanitizer, yung hand gel sanitizer or alcohol-based sanitizer. So that every so often, pag meron po tayong nahahawakan, we should now be mindful of cleaning our hands every so often. So as to prevent po na tayo mismo pala ang naghatid ng virus into our body. Okay?
That's very right. And also, as you can see with Dr. Aileen, there's definitely a lot to talk about, and we hope this conversation will help you understand how you can stay safe and healthy as you go about your day to day in this time of COVID-19. We'll be right back in the Doctor's In. It's good to have you with us. I'm Dr. Freddie Gomez, and we want to make the most out of your telemedicine appointment today. So please send us your questions via the CNN Philippines Facebook page. Earlier, we talked about places that we can most likely contract the virus. So pinag-usapan ni Dr. Aileen, ang guest natin yun ngayon. Ano? So it's very vital to take the necessary precautions in these situations. So Dr. Aileen Espina is with us on the show. She is a family medicine specialist. So navigating the new normal can be significantly harder. There are a few steps we need to take to ensure safety. But if you think about it, a lot of it is very basic. Yung good personal hygiene, hand washing, katulad sinabi rin kanina, covering your mouth when you sneeze or you cough. But admittedly though, it is not easy, especially when we are advised to maintain social distancing, and that's not always possible. Lalo na ngayon, ilan sa mga public transportation vehicles ay nakakabalik na rin katulad ng mga buses at jeepneys. So my question for you, Dr. Aileen, is when commuting, what should be the mindset considering na nandyan pa rin ang threat ng COVID-19?
Thank you very much, Ferdy. No, this is a very timely question because we all have read na there were quite a number of employees of the MRT that has been infected with the COVID virus. So when we are outside and we are commuting, we should be mindful talaga, like from paglabas pa lang ng bahay, and then we're already in the pila, on the line, waiting for the public transport. We should really maintain that distance. No, maintain the line. Meron kasing queuing spots that has been marked already in the ano sa waiting areas. Tapos I just would like to share with you that I'm part of the group. I'm part of the Philippine Society of Public Health Physicians, and we were part, together with the Philippine Academy of Family Physicians also, we were a signatory of a letter to the IATF regarding transportation. So we worked with Commute and Centro and a lot of other CSOs with regards to this particular issue. And among the recommendations that we have sent to the IATF is to ensure that there is really distancing that is observed in our public transportation. No, we recommend physical distancing. So sa mga buses po natin ngayon, meron po talagang mga designated seats na dapat wala pong nakaupo. So maging ano po tayo alerto, no, na yung distance na yon should really be maintained. Wag na po tayong bumalik sa nakasanayan natin na nagsisiksikan tayo sa jeep, sa bus or sa MRT. Second, dapat po siguraduhin natin na lahat ng katabi natin, lahat ng sumasakay sa public transportation, nakasuot ng mask. lahat po tayo, no mask, no ride. Magtulungan po tayo, no? Sawayin po natin yung pasaway. As a community, kung ito yung kailangan talaga ng shaming, parang ako nag-agree ako na sabihin natin, pwede po mag-mask kayo bago kayo sumakay, no? Then second, we hope that we can institutionalize na yung tulad sa in other countries wherein they don't use cash transactions in public transportation, yung mga tinatap na lang, no? Then mas maganda yung you pay before you ride. So maghanda po kayo ng eksaktong pambayad, no? Yung eksaktong pamasahe. So that hindi na po kayo susuklian at hindi na po ipapasa-pasa yung pera, no? Tapos pag nandun po kayo sa sa pampasaherong sasakyan, minimize po muna yung minimize talking to each other. So kanya-kanya lang po muna, magdala po muna kayo siguro ng you load your iPad with or your music, and then you can read while nasa traffic po kayo, so that you will minimize talking to each other. Tapos po pagsakay ninyo ng jeep, kung nakahawak kayo ng handrail or ng bus, ugaliin po ninyo na mag-hand rub kayo or mag ano kayo ng hand sanitizer. So you do a hand rub so that you're sure na when yung pinang ano niyo ng pera, malinisan po yung inyong kamay. Then for the ano naman po, jeepney or the public transportation owners, please ensure that your vehicles are well sanitized. So dapat po may process po kayo ng pag-cleaning ng vehicle po ninyo. Tapos, we also hope that a system can be process na yung no stop policy, parang point to point, para hindi po siya sasaka, parang titigil ng titigil, it will minimize yung natin, yung sino yung katabi mo. Ang iniisip din po kasi namin, how can there be a way that we can monitor yung seating arrangement, sino yung katabi mo, no? We don't recommend po yung we don't recommend yung checking of temperature. Let it be a common sense na lang po na kung may nararamdaman po kayong lagnat or kakaiba sa inyong katangan, wag na po kayong lumabas ng bahay. Makipag-ugnayan po kasi sa inyong doktor through telemedicine. Okay? Also, I am not endorsing any particular contact tracing app, but there are so many in the market, but I really believe in its utility in monitoring po mobility, and it will really aid in contact tracing. The proximity apps, like for example Novid or Stay Safe, or marami po dyan, it can really tell you kung yung katabi mo is infected or not. It will send out an alarm. So using those kinds of technology, I think would also be very helpful. So, yun lang. Those are some of the tips
Alright.
that I can think of as
Yeah,
of
that's
the
right. Ano?
moment.
So dapat talaga ay mentally prepared tayo sa tuwing nasa labas ng bahay para maiwasan ang infection. Sabi nga nila is act as if you have the virus. So remember, while
Yes.
there's no cure for COVID-19, there are ways to protect ourselves from the virus. So practice social distancing and proper hand washing are essential to ensure our safety. So that's a reminder that you will hear from us very often. So thank you very much for joining us on the show, Dr. Aileen, and also for those dealing with underlying conditions. Please talk with your healthcare providers. Just make sure that before you step out of your house and do your daily things, that you are safe and secured as well. But we do hope that our discussion today has been helpful to you. So, we have to pause for a break, but when we come back, some helpful reminders on what we can all do as soon as our day is over and we're ready to come home. Amid this pandemic, there are ways to keep the rest of our families safe. Stay tuned to CNN Philippines. Thank you for joining us. You're watching The Doctor is In, and I'm Dr. Freddie Gomez. So while it's vital to take safety measures before going out, it is equally important to practice these measures when you're coming home from a busy day. So our next guest for today is Juan Miguel Velasco. He's the nurse manager of the Medical and Surgical Intensive Care Unit at the Makati Medical Center. Welcome to the program, Nurse Miguel.
Hi, Doctor. Good afternoon po. And good afternoon po sa lahat.
Now, Nurse Miguel, kahit na may pandemic, many citizens need to go out to work. No? They have to go about their daily lives to buy supplies and also basically to do several things, errands or whatnot. And basically, life must go on, kumbaga sabi nga nila. At the same time, we want to make sure that our loved ones are safe when we return home. What is the proper way of disinfecting after a day out?
Okay. So, actually po, na-mention na rin ni Dr. Aileen Espina kanina yung mga basic protocols po natin. No? So, it's actually the same as what the government and DOH has been reminding us ever since the pandemic began. So, dito sa aming hospital, what we practice is yung proper donning and doffing protocol. So, donning is yung how to correctly put on your personal protective equipment, and yung doffing naman is actually how to take it off. So, once we go home dun sa amin, kasi kami di ba nagjo-duty kami every day, so nag-cater kami to the different COVID patients. So after we render our duty, we are always advised na mag-take kami ng shower. So we do have designated shower areas dito sa aming unit, kasi kailangan natin ma-disinfect hindi lang yung equipment ng mga nagamit natin. So syempre pati yung tayo personally bago tayo umuwi sa ating mga bahay. So dun sa question na po, Doctor, regarding dun sa pag hindi mo ma-prevent na lumabas, kailangan mo mag-shopping or kailangan mag-groceries. So I do advise na same as yung sinasabi natin ng DOH na always wear your mask and avoid touching unnecessary objects. So hindi naman may iwasan yun pag nagkakaroon kayo ng mga magkakaroon ka ng close contact with other people, pero at least man lang maintain yung social distancing pa rin procedures, social distancing protocols natin. And dito sa hospital, as an additional
That's
safety
right.
precaution for our staff, to encourage kami to wear at least yung disposable or washable scrub suits, and hindi allowed kami na iuwi namin yung mga washable scrub suits na yun. So basically, we come to work in our civilian clothes, then we just change into our scrub suits here. So ganun din yung isa sa mga ma-advise ko sa mga hindi nila mape-prevent lumabas ng bahay. So at least pagka-uwi nyo, mag-change kayo agad. Maligo kayo, mag-change kayo into new clothes before kayo halubilo with your other family members.
That's right. So all of those measures are to keep not just yourself but your family members safe as well. And hand washing cannot be rushed. Like you said, no, one of the important things of hand washing is to take your time. So to wash off and get rid of those germs in your hands. So we have a lot of questions in line for us today. No, marami nagtatanong. Let's answer some of them. We have ang unang tanong natin ay mula kay RD. Ang sabi ni RD, if exposed to the virus, does taking a bath reduce the likelihood of acquiring the infection? What do you think, Miguel?
Sorry. For me, yes. Kasi yung virus, di ba, as explained to us, ito yung, kumbaga, kumakapit kasi siya sa system mo eh. So, isa sa mga pinaka-effective ways for us to, kumbaga, hindi mahawa dun sa virus or hindi natin ma-transmit to other people is, syempre, through proper hand washing. So, ang advice dyan is yung do proper hand washing with soap and water, di ba? So, para at least matanggal natin yung virus sa ating kamay or kung dumikit man siya sa any part of our bodies, before we touch someone else or before we touch our face, before you touch your nose or mouth. So, very, very effective yan. So, kaya nga sinasabi po lagi sa atin is basic lang po yung ating preventive measures. So, kaya kailangan po talaga, kaya po natin siya talagang sundin.
That's right. So all of these things definitely have to be done in order to protect those around us. And like what you said, Miguel, everything is pretty much basic. So it is something, the only factor na nagiging hadlang dito is sometimes nagiging routine na sa atin, but we just have to remind ourselves the importance of all of these things that we are doing. So thank you very much, Miguel, for joining us today. And we'd like to thank everyone as well for sending in your questions. Stay safe, everyone. I'm Dr. Freddie Gomez, and I look forward to seeing you again tomorrow.